Well, I'm here today with Tanya Harris, our district nurse. We were going to talk a little bit about some healthcare issues that we are addressing as we do the reopening of school. Obviously, this is a major issue for us. As our viewers know, we had a number of restrictions that we needed to work into our reopening plan. One of the major restrictions, of course, is that everyone wear a mask while at school. Social distancing was also an issue. And more recently, the Illinois Department of Public Health gave us a number of guidelines that we need to follow. And so Tanya and I thought it might be a good idea to share some of that information with our parents and our community. So Tanya, you want to kind of hit the high points of what the Illinois Department of Public Health has said in terms of students who come to school with symptoms?
Absolutely. Okay, so we have several symptoms that can be a regular health problem, but could also indicate COVID. So what they have said is that if anyone presents with even just one of the symptoms, that we are to send them home. To be able to come back, you have to have a negative COVID test or self-isolate for the 10 days. Runny nose, headache, cough, sore throat, nausea, vomiting, diarrhea, obviously temperatures, which we'll be checking here too. There are a lot of symptoms that unfortunately will require us to send students home.
And since we're on that topic, let's talk a little bit about that. So if a student presents to us, say, in the middle of the morning at 9 o'clock in the morning and complains to his teacher or her teacher about one of these symptoms, we're going to have to take that student out of the classroom. Now, one of the things that we've done in preparation for this is we've relocated your office. So can you tell folks where you're going to be?
I am going to be in the west side of the building rather than in the building. They've moved me out to a modular in the back, and that is done because if anyone shows up with these symptoms, we do have to isolate them. They will be in a larger room where I'm able to keep them distant 6 feet apart and away from anyone else at that time. So in the back, if you are coming to pick up your child for any reason that they're sent home, they'll actually be picked up at the modular in the back. I think one of the other things, Mr. Ward, while we're on this topic, that it's important to note that if a student does report with symptoms in the middle of the day or at any time really, that does involve any siblings that they have as well.
Right.
We would have to send those home as well.
Yeah, I think it's very important for our community to understand that if a student presents one of these symptoms to us, either at our screening locations or during the school day, it's not only that student, but also anyone else in that household who will have to go home. And they cannot return until either the 10-day isolation or that particular student gets the negative test and can provide us with those examples. So we could see a number of students being sent home based on some of these symptoms, and that's been one of our big challenges.
Correct, yes.
And that's why we moved you to the modular, is because we anticipate that we're going to have several students in isolation based on this criteria. Correct?
Yes, and plenty of room out there.
Yeah. Let's talk a little bit about screening and where our screenings are going to take place and what will happen at that point. Can you tell the community a little bit about that?
For our students that are bus riders, we do have bus monitors that are going to be riding the routes this year. They will be checking for the symptoms and temps prior to a student even getting on the bus. So I think one of the highlights we need to hit while we're right here on this part is we do need someone to be available for those children in case they would not pass the screening at the time of getting on the bus. They need to be able to go back home. We need to be able to have an adult that's available there to take them back, to isolate.
Right, and again, I want to emphasize, if we have a family that's boarding, none of the students will get on the bus until all of the students have been screened. And if they don't have any of the symptoms and if their temperature is less than 100.4 degrees, everybody can get on the bus. But if a student presents at 100.4 or higher, then those students, the siblings as well as that student, will need to return to the home. And so we really need our parents to have a plan so that if we are saying you can't get on a bus, that the kids can go home safely. And if not, we'll be in contact with the parent and work out something. But it's vital to us that we have to keep those students off the bus.
I think another important fact to bring in right here too is please make sure you have updated information in the system for us so that we have available contacts that we can make quickly. For car riders, we are planning to screen them as they are dropped off before they even make it out of the car. So you'll have to bear with us. I'm sure that'll take a couple of days to work the kinks out of that, but we'll get there. And we do have screeners set up at certain doors in which the students will come in. One of the things I would like to ask the public's help with is if you have a family of kids that walks together, but one might be grade school, one might be middle school or high school, we do ask that you please have them all come in the same door so we can screen families together at that time, but we will have people available at the entrances. We will keep kids 6 feet apart while we're doing all of our screenings, and we will get every student screened before they get in the building.
And again, I think you brought up a good point about asking people to be patient with us at drop-offs. It's going to take a little bit more time. We'll get faster as we go. We are keeping our door shut until 7:45. So we're going to try to get everyone in the building who's a walker or a rider or a driver in the building between 7:45 and 8 o'clock. And we realize the first few days that's probably not going to be exact there, but we're going to do our best. And again, you just need to be patient with us and understand as we get better at doing the screenings and get better, we'll figure out what might work to speed it up. We have a lot of people dedicated to being out there to do the screening, but it's still going to take some time. I wanted to ask you a little bit about what happens if we have an individual who is in close contact with someone who is positive for COVID. What will happen with that individual?
That individual is going to be sent home as well. We do have a partnership, I guess is the best way to say it, with the Illinois Health Department. We can always contact them and ask, but they are the ones that are going to be doing contact tracing. So if there are questions about that, don't be alarmed. You may hear from them versus us. I will be in, like I said, it's a partnership with them. So the contact tracing then will take place as well. And we ask, please answer your phone if they call or if we call for that. But we will have to send home anyone. Close contact would be considered anyone who has been within 6 feet for more than 15 minutes. Would be considered a close contact.
Right, and I think it's important to know then that person goes home and they're in quarantine for 14 days. There is no testing out of that. Even if the person you're in close contact with was suspected and they're negative, you have to stay in that quarantine for 14 days, correct?
Correct.
I think it's also important to know, I'm sure parents want to know, what happens if we end up with a student or one of our employees who tests positive for COVID and they've been in the building. What's our response going to be?
Unless that person has been a close contact, you would not hear from necessarily the health department. We would obviously let anyone know that needed to know that was a potential contact. So we would obviously be sharing that information on a need-to-know basis. But if your student is anywhere in question of having been in contact, we will be tracing that, keeping track of that.
And so obviously there is a possibility that a classroom or a number of students from a classroom could be sent home for quarantine. If we have positive cases, we'll notify the community via our alert system that we would use. You'll get an email and we'll have it on our website, social media, that there's been a positive case. It could require the closure of school from anywhere to 2 to 5 days. And if in that event, we're going to work with the Mason County Department of Public Health to kind of give us guidance on where that's going to be. But on a more positive note, we have a good plan for cleaning. We have a good plan in place to make sure that our classrooms are cleaned to the CDC standards on a daily basis. We have our hallways marked. We have social distancing areas marked. So from that side, I think we've done a pretty good job.
I agree. Everyone's worked really hard over the summer to give us the opportunity to be able to open, and I appreciate everybody's hard work for that, for sure.
Sure. Is there anything else that you think we should be talking about when it comes to some other public health issues and how we're going to deal with those at school?
Public health issues, I feel confident that we have all of the plans in place for that. As far as the day-to-day basis of things that are normal and typical in my day, I do think it's important to let parents know that since meals will not be served here and we are opening the buildings just a little bit later, We will not be giving medications at school while we are on these shortened days. So all morning medications truly do need to be given at home by the parent. Lunchtime medications will not be given as well until we would transition into the longer day and actually be serving meds here. So the only medications that need to be here at school for our first phase of opening would really be the emergency medications, our EpiPens, inhalers,
Diabetes.
things our diabetic children would still carry their kits.
Great.
But all prescription meds need to be given at home.
And I think it's also important to note, we have put first aid kits in all of the classrooms, because some of Mrs. Harris's clients oftentimes are students who have very minor issues, but they get sent to the nurse's office. Under these new rules, we just can't have that type of traffic flow in the building. So our teachers will be equipped to handle some of those things. Also, we've hired some assistants for you. You want to talk about that?
Yes, I'm happy to talk about that. During these challenging times, there are some increased things that everyone is doing. So the district has hired someone to work with me. Her name is Kendra Kelly. She is an LPN and will be able to offer a lot of help to the health service area, and I'm very excited to have her join the team.
So again, we'll have another trained medical person. So if there is a crisis inside the building that needs your attention or someone's attention, we can still monitor the health services building and get inside and take care of the other issues.
Absolutely.
Great. Anything else you think our community needs to know about today?
I'm not sure, just be patient with us. We're all dealing with these new changes. We appreciate your patience. We are excited to have students back in the building, and we've been working very hard to make that happen. One thing that I can think of, Mr. Ward, is if your student wakes up in the morning and isn't feeling well, and you're concerned that they would be sent home possibly, it might be best for you to just keep your child home that day, monitor them for 24 hours, see how things are going, and if those types of things improve. So it's going to be very important that if you know your child is ill, you keep them home this year.
Yeah, that's a great point. I want to echo that. I think if there's any doubt, play it safe and keep your child at home for the day and see if those symptoms go away, because again, that's one day trading off against maybe 4 or 5 days if you have to go get a COVID test, or even the 10 if you're not able to get tested. So I think that's pretty important. The other thing that I want to mention is we're following Illinois Department of Public Health and Illinois State Board of Education guidance. That guidance changes often. It's changed multiple times since you and I began working on this part of our plan.
Yes.
So anything that you see in writing, I'm going to forewarn you, could be changed. And we're going to try to keep you updated with all of those changes as they occur.
Absolutely.
All right. Well, thank you, Ms. Harris. I appreciate your time today. And
Thank you.
again, can't wait to see the kids back next week. Thank you.